The greatest prison people live is is the fear of what the other people think. That is the main fear that the people just can't do the real talented work which they have in them, just that what the other people think. So stop thinking like this. What the, do whatever you talent do. Now, congenital rubella syndrome, it is the infection by the rubella virus during the early pregnancy or intrauterine infection cause result is a miscarriage or a child born with congenital rubella syndrome. In congenital rubella syndrome, it manifests as the problems with the eye, such as the cataract, the ears problem causing the deafness, cerebral and cardiac defects like patent ductus arteriosus, also causes prematurity, low birth weight, neonatal thrombocytopenia, anemia, and hepatitis to the newborn. Problems are rare after 20th week of pregnancy. So here one can see the microcephaly, the smaller size of the head, the heart disease, ductus arteriosus, TKI, and the purpura, that is thrombocytopenia. Eye abnormalities may include cataracts, glaucoma, strabismus, nystagmus, microphthalmia, and iris dysplasia. These are all the feature of chronic congenital rubella syndrome. The risk of the major defects in the organogenesis is highest for the infection in the first trimester if one is infected by the rubella virus and the female is pregnant. CRS was main reason a vaccine for the rubella was developed to avoid this congenital rubella syndrome. 80 to 90% of the mothers who contract rubella within the first trimester have either a miscarriage or a stillborn baby. The skin manifestations are called blueberry muffin lesion seen in the newborn, and so rubella is included in the torch complex of perinatal infection. So here it is the rubella syndrome with microcephaly, patent ductus arteriosus, and cataract. I have already shown you. And this is the blueberry muffin rash of rubella behind the ear on the whole body that has been seen as the part of presentation of rubella disease. Now, what are the complications of the rubella? Severe complications are brain inflammation like encephalitis, intellectual disability, neuritis, low platelet count, ear infection, liver or spleen damage, orchitis, inflammation of the testes, coryza in the rubella may convert to the pneumonia, either viral pneumonia or the secondary bacterial pneumonia. And similarly, the bronchitis occurs either viral bronchitis or the secondary bacterial bronchitis. Now, what is the diagnosis of rubella? It is of two types, as one know that it is causing the problem in the pregnant woman. So we have divided it into two, the prenatal and postnatal. Number one, the prenatal. Examination of the amniotic fluid for virus isolation, RT-PCR, and specific IgM antibodies can be detected in the 21st week of pregnancy in the blood of the child. The postnatal type is history of the exposure or consistent clinical findings like fever or maculopapular classical rash, lymphadenopathy or arthralgia, or the arthritis is there, So the diagnosis of the congenital rubella syndrome is the demonstration of the rubella antibodies of IgM in the newborn is diagnostic value as IgM group do not cross the placenta and they are produced in the infected fetus only. So that is the infection gone to the fetus. There is antibody and here is the immune complex which can detect and cause the diagnosis. Now, continuing the diagnosis, postnatal rubella virus specific IgM antibodies seen in the people recently infected. These antibodies persist for over a year. Fourfold rise in the IgG antibodies seen. Positive test result should be interpreted with caution to consider that whether it is rubella or not. The presence of these antibodies with characteristic rash confirms the diagnosis, not only the mere presence of the antibodies. Finding virus in the nasopharynx, blood, or urine in the tissue culture, then PCR can help and antenatal screening of the pregnant woman is necessary. Here is the imagination of a painter. One can think the water is coming, but from where? The source is not obvious. But it is true, it is there somewhere in the world that the water is coming without having any connection with the water pipe. Now, the treatment of the rubella, once infected, there is no specific treatment. Symptomatic treatment is given according to the need of the patient. Rates of the disease have decreased as a result of the vaccination. So, give plenty of rest to the patient. Take lot of fluids like water or squash. Give paracetamol or ibuprofen, but do not give aspirin to children under 16 to avoid the Reye syndrome. Treatment of the newborn babies is management of the complications only. Now, congenital heart defects and the cataract are corrected by the surgery as the part of the treatment. Management for the ocular congenital rubella syndrome is similar to that for macular degeneration. Counseling, regular monitoring, and provision of the low vision devices is advisable. There are ongoing efforts to eliminate disease globally, and Cuba has eliminated this disease in 1990, and United States in 2004, and Australia has just eliminated in 2018. In April 2015, WHO has declared Americans free of the rubella transmission. Now, prevention of the rubella. Rubella is preventable with rubella vaccine. A single dose is 95% effective. It is given in combination with measles and mumps vaccine as MMR vaccine. WHO recommends first dose of MMR at 12 to 18 months and a second dose at 36 months. As active immunization with live attenuated virus vaccine. Two live attenuated virus vaccines, RA27/3 and Sandy Hill strains are effective. Their use in prepubertal females not cause a fall in overall incidence rate of chronic rubella, congenital rubella syndrome. So here it is MMR, measles, mumps and rubella vaccine which is given to the patient for prevention. Reductions were achieved by immunization of all children. Pregnant women are tested for immunity to the rubella. Women found susceptible are not vaccinated until after baby birth, as the vaccine contains the live virus and can cause infection to the coming baby. The immunization program is successful. Cuba eliminated disease 1990, United States 2004, and Australia 2018, as I have already told you before. In susceptible people, passive immunization is used sometime as immunoglobulin given fifth day post-exposure to avoid the complication. Stay off nursery, school, or work for 5 days after the rash appears as the part of prevention. Try to avoid close contact with anyone who is pregnant. Wash your hands often with the soap and warm water. Use tissue when you cough, talk loudly, or sneeze. Throw used tissues in the bin and do not share cutlery, cups, towels, clothes, or bedding. Prognosis of the disease, rubella infection of the children and adult is usually mild, self-limiting, and often asymptomatic. The prognosis in children born with congenital rubella syndrome is poor. And that is the end of the lecture. I hope you may have liked this lecture. If you have liked this, please subscribe it and share it with the others. I have given a very comprehensive lecture, and still if there is any question or query, please call me. And thank you very much to be with me for this lecture, and please like and share. Thank you.